Have you ever been told that your blood pressure should always be below 120/80? What if I told you that for many older adults, the answer may not be that simple? In fact, chasing the wrong blood pressure target could sometimes create problems just as serious as high blood pressure itself. Millions of seniors spend years worrying about a single number without realizing that age, health conditions, medications, balance, and overall quality of life all play an important role in determining what blood pressure is truly best for them. Today we're going to uncover one of the most misunderstood topics in senior health, the ideal blood pressure for older adults. Some people believe lower is always better. Others assume higher blood pressure is a normal part of aging and nothing to worry about. The truth lies somewhere in between, and understanding that truth could help protect your heart, brain, kidneys, mobility, and independence. Throughout this discussion, you'll discover why blood pressure targets are different for different people, warning signs that your numbers may be too high or too low, and the latest recommendations that healthcare professionals consider when helping older adults stay healthy. You'll also learn practical steps that can improve blood pressure naturally without extreme diets or exhausting exercise routines. Most importantly, we'll explore how to find a balance that supports longevity while helping you feel strong, energetic, and confident in your daily life. If you or someone you love is over the age of 60, stay with me until the very end, because one small misunderstanding about blood pressure could be affecting your health right now without you even realizing it. One of the biggest misconceptions about blood pressure is the belief that the same number is ideal for everyone, regardless of age. While a blood pressure reading of 120/80 millimeters or mercury is often considered the standard for healthy adults, the reality is much more complex for older individuals. As we age, our bodies undergo natural changes that can affect how blood pressure behaves. Arteries gradually become stiffer and less flexible, making it more difficult for blood to flow smoothly. As a result, systolic blood pressure, the top number in a reading, often rises with age even in otherwise healthy people. This does not mean that high blood pressure should be ignored. Elevated blood pressure remains one of the leading risk factors for heart disease, stroke, kidney disease, and cognitive decline. However, healthcare providers increasingly recognize that blood pressure goals must be individualized. A healthy and active 65-year-old may benefit from a different target than a frail 85-year-old who experiences dizziness, balance problems, or multiple chronic conditions. Another important factor is medication. Many older adults take medications to control blood pressure, but overly aggressive treatment can sometimes lower blood pressure too much. When blood pressure drops excessively, it can reduce blood flow to vital organs and increase the risk of falls, fainting, and injuries. This is why healthcare professionals often look beyond a single number and consider the whole person when determining the best blood pressure range. Research over the past decade has shown that carefully controlled blood pressure can reduce the risk of serious cardiovascular events, but experts continue to emphasize the importance of balancing benefits and risks. Rather than focusing solely on achieving a perfect reading, older adults should work with their healthcare providers to establish a realistic target that supports heart health, preserves independence, and helps maintain the highest possible quality of life while taking into account their unique medical history, lifestyle, and overall health status. High blood pressure is often called the silent killer, and for good reason. Many older adults can live for years with elevated blood pressure without experiencing any obvious symptoms. They may feel perfectly fine while damage is slowly occurring inside their body. This hidden nature of high blood pressure is what makes it so dangerous. Over time, excessive pressure against the artery walls forces the heart to work harder than it should, increasing the risk of serious health complications that can dramatically affect quality of life and independence. One of the greatest dangers is stroke. When blood pressure remains consistently high, it can weaken or damage blood vessels in the brain. This increases the likelihood of a blockage or rupture that can lead to a stroke, potentially causing paralysis, speech difficulties, memory problems, or permanent disability. High blood pressure is also a major contributor to heart attacks because it accelerates the buildup of plaque inside the arteries, reducing blood flow to the heart muscle. The kidneys are another organ that suffers from uncontrolled blood pressure. These vital organs depend on a network of delicate blood vessels to filter waste from the body. Over time, high blood pressure can damage these vessels, reducing kidney function and increasing the risk of chronic kidney disease. Many older adults are unaware that blood pressure and kidney health are closely connected until significant damage has already occurred. In addition to affecting the heart, brain, and kidneys, high blood pressure may contribute to vision problems and cognitive decline. Research suggests that long-term vascular damage can reduce blood flow to important areas of the brain, potentially increasing the risk of memory difficulties and dementia later in life. The challenge is that these effects develop gradually, making them easy to overlook until they become serious. Understanding these hidden dangers highlights why regular monitoring, proper treatment, and healthy lifestyle habits are so important for maintaining strength, independence, and overall well-being throughout the aging process. While most conversations about blood pressure focus on numbers that are too high, many older adults are surprised to learn that blood pressure can also be too low. In fact, excessively low blood pressure may create its own set of health concerns, especially in seniors. Although low blood pressure is often viewed as a sign of good health, that is not always the case. When blood pressure drops below what the body needs, vital organs such as the brain, heart, and kidneys may not receive an adequate supply of oxygen-rich blood. One of the most common symptoms of low blood pressure is dizziness, particularly when standing up from a chair or getting out of bed. This sudden drop, known as orthostatic hypotension, becomes more common with age because the body's inability to regulate blood pressure can slow down over time. A brief moment of lightheadedness may seem harmless, but it significantly increases the risk of falls, which are one of the leading causes of injury and hospitalization among older adults. Low blood pressure can also cause fatigue, weakness, blurred vision, confusion, and difficulty concentrating. In some cases, seniors may assume these symptoms are simply a normal part of aging when they are actually related to insufficient blood flow throughout the body. If blood pressure falls too low, it can even lead to fainting episodes that result in serious injuries. Several factors can contribute to low blood pressure in older adults. Dehydration, certain medications, heart conditions, prolonged bed rest, and nutritional deficiencies are among the most common causes. Sometimes blood pressure medications that successfully lower high readings may unintentionally reduce blood pressure more than necessary, especially when combined with other medications. This is why healthcare providers carefully evaluate both symptoms and blood pressure readings rather than focusing only on achieving the lowest possible number. The goal is not simply lower blood pressure, the healthy range that allows older adults to remain active, alert, steady on their feet, and capable of enjoying daily life without unnecessary risks or complications from poor circulation. One of the most important questions older adults ask is, what should my blood pressure actually be? The answer has evolved over the years, as new research has provided a better understanding of how blood pressure affects aging bodies. Modern studies have shown that maintaining healthy blood pressure can significantly reduce the risk of heart attacks, strokes, heart failure, and other cardiovascular problems. However, these same studies have also highlighted that there is no single target that works perfectly for every senior. Current medical guidelines generally recommend that many healthy older adults aim for a systolic blood pressure below 130 millimeters mercury, provided they can achieve that goal safely and without troublesome side effects. Research has demonstrated that controlling blood pressure within this range can lower the likelihood of serious cardiovascular events and help protect long-term health. At the same time, experts recognize that older adults vary widely in their overall health, mobility, medication tolerance, and medical history. For example, an active 70-year-old who exercises regularly and has few health conditions may be able to maintain a lower blood pressure target comfortably. On the other hand, an 85-year-old with multiple chronic illnesses, balance issues, or a history of falls may require a more flexible approach. In these situations, aggressively lowering blood pressure could increase the risk of dizziness, fainting, or injuries. This is why healthcare providers often focus on individualized care, rather than strict adherence to a single number. Another key finding from recent research is that blood pressure should be measured consistently and accurately. Readings taken at home over several days often provide a clearer picture than a single measurement obtained during a medical appointment. Stress, anxiety, and even rushing to a clinic can temporarily elevate blood pressure, leading to misleading results. The growing body of evidence emphasizes that successful blood pressure management is about more than achieving a specific reading. It involves balancing cardiovascular protection with safety, comfort, independence, and overall quality of life, ensuring that treatment decisions support both longevity and day-to-day well-being. As people continue to age, many older adults assume that blood pressure is controlled primarily through medication, but daily lifestyle habits can have a surprisingly powerful impact on blood pressure levels. In fact, some of the most effective strategies for maintaining healthy blood pressure are simple behaviors that can be practiced consistently over time. While medications may be necessary for many people, lifestyle choices often determine how well those treatments work, and can sometimes reduce the need for additional medications. Physical activity is one of the most important factors. Regular movement helps strengthen the heart, improve circulation, and increase the flexibility of blood vessels. Older adults do not need intense workouts to experience benefits. Activities such as walking, swimming, cycling, gardening, or even gentle chair exercises can contribute to healthier blood pressure when performed regularly. Consistency is often more important than intensity. Nutrition also plays a major role. Diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provide nutrients that support cardiovascular health. Reducing excessive sodium intake can help prevent fluid retention and lower strain on blood vessels. At the same time, foods containing potassium, magnesium, and fiber may contribute to healthier blood pressure regulation. Small dietary improvements made over months and years can produce meaningful results. Sleep quality is another frequently overlooked factor. Poor sleep can increase stress hormones and interfere with the body's ability to regulate blood pressure effectively. Many older adults experience sleep difficulties, but improving sleep habits can support both heart health and overall well-being. Managing stress is equally important, because chronic stress may contribute to elevated blood pressure over time. Maintaining a healthy weight, limiting excessive alcohol consumption, staying hydrated, and avoiding tobacco products can further support healthy blood pressure levels. These habits work together, rather than independently, creating a cumulative effect that benefits the entire cardiovascular system. Even modest improvements in daily routines can make a noticeable difference. The goal is not perfection, but sustainable lifestyle choices that help older adults maintain healthier blood pressure, reduce health risks, preserve independence, and enjoy a more active and fulfilling life as they age. Many older adults check their blood pressure regularly. Knowing when to seek medical guidance is just as important as knowing the numbers themselves. Blood pressure is not something that should be managed based solely on internet advice, family experiences, or generalized recommendations. Every person has a unique medical history, and the ideal blood pressure goal can vary depending on age, medications, existing health conditions, and overall physical function. This is why maintaining an open conversation with a healthcare provider is an essential part of Human Policy, protecting long-term health. One reason to speak with a doctor is if blood pressure readings consistently remain above the doctor target range that has been recommended for you. Even if you feel completely normal, persistently elevated blood pressure can increase the risk of heart disease, stroke, kidney damage, and other serious complications. A healthcare professional can determine whether lifestyle changes, medication adjustments, or further evaluation may be necessary. It is equally important to seek medical advice if blood pressure readings become unusually low or if symptoms begin to appear. Dizziness, lightheadedness, fainting, blurred vision, unusual fatigue, confusion, or frequent falls should never be ignored. These symptoms may indicate that blood pressure is dropping too low or that another underlying condition requires attention. For older adults, preventing falls is a major priority because even a minor fall can lead to significant injuries and loss of independence. Changes in health status are another reason to review blood pressure goals with a healthcare SUNCOM. But a new diagnosis, hospitalization, medication change, weight loss, or change in activity level can all affect blood pressure management. What was appropriate a few years ago may no longer be the best approach today. Regular discussions with a healthcare professional allow blood pressure goals to be adjusted as circumstances change. The objective is not simply to achieve a specific number, but to create a personalized plan that balances cardiovascular protection with safety, comfort, mobility, and quality of life, helping older adults remain healthy, active, and independent for as long as possible. Here is the final conclusion for your speech. As we come to the end of today's discussion, remember that the best blood pressure for older adults is not about chasing the lowest possible number or comparing your readings to someone else's. It's about finding the range that keeps your heart, brain, kidneys, and entire body functioning at their best, while allowing you to remain active, independent, and confident in your daily life. High blood pressure can quietly damage your health for years. Blood pressure that is too low can also create serious risks, especially as we age. The most important lesson is that blood pressure management should be personalized. For age, medical history, medications, activity level, and overall health all play a role in determining what target is right for you. Rather than focusing on a single reading, focus on long-term habits that support healthy blood pressure, including regular physical activity, nutritious eating, quality sleep, stress management, and routine monitoring. Never ignore persistent changes in your blood pressure or symptoms such as dizziness, weakness, chest discomfort, shortness of breath, or frequent falls. These signs deserve attention and should be discussed with your healthcare provider. Small adjustments made today can prevent major health problems tomorrow. Growing older does not mean giving up control of your health. In many ways, it means becoming more intentional about the choices you make every day. By understanding your blood pressure, monitoring it regularly, and working with your healthcare team, you can reduce your risk of serious complications and continue enjoying the activities and people you love most. Your goal is not simply to live longer, it is to live better, stronger, and healthier. And sometimes, one of the most powerful steps toward that goal is knowing the blood pressure range that is truly right for you and taking consistent action to protect it every single day.